Hello, everyone, and welcome back to another episode of MedSynapse podcast series. I'm your host, Hetvi Shah, and today we are diving into a topic that is sparking a lot of discussions in clinics, communities, and policy circles alike, which is vaping and e cigarettes, the myths, evidences, and clinical conversations with it. And joining me is Dr. Sandy Roberts, clinical pulmonologist based in Visakhapatnam. Dr. Roberts is deeply committed to advancing respiratory health through evidence based, patient centered care. His expertise spans interventional pulmonology, asthma management, sleep medicine, and smoking cessation, with affiliations across multiple hospitals and a strong passion for global pulmonology standards. Doctor brings a holistic and internationally informed perspective to this critical issue. So, Doctor, we are so glad to have this conversation with you and welcome to the show.
Thank you, Nisha. It's really nice to hear all that good words from you. Let's quickly dive deep into the topic. We have, no, as we've discussed before, we are discussing about vaping today. So, let's have a good talk regarding the vaping, and hopefully it turns into a good one.
Yeah, sure, Doctor. So,
Thank you.
Doctor, set the stage. Could you start by giving us a brief overview of how actually vaping devices actually work and how they differ from traditional cigarettes?
All right. So, I'll make it very simple for you. So, how does the traditional smoking the cigarette work? It looks like, a small white cylindrical tube-like kind of structure. You burn it to light it up. You take a harsh, hot smoke deep into yourself. You inhale it and then you exhale. All right. That is what is the actual conventional smoking is like. But coming to vaping, it's a small device where it has battery. It's
Mm-hmm.
powered by a battery. It has something called as an atomizer. Atomizer is something which heats up the liquid. There's also a cartridge in the vaping e-cigarette. So this atomizer will heat up this liquid in the cartridge, and then that is how you get the smoke. The liquid in the cartridge will be atomized into smoke, and then you'll inhale it. That is how it works. So conventional cigarette is a little harsher. It delivers more nicotine, and vaping it delivers nicotine in a effective way too, but it is smoother than the conventional cigarette. Right? That is the main difference, and conventional cigarette has multiple way more toxins than you can imagine, and the e-cigarette, even it has some toxins such as formaldehyde, heavy metals. Even they are toxic to your body, but yeah, it is a little safer than the conventional cigarette. That's the thing.
Yeah. Correct. I think that's a very clear breakdown, Doctor, and I think a lot of people don't realize this also. So now, Doctor, now one of the biggest concerns in the public health space is whether vaping serves as a gateway to smoking, and what does current data suggest about the risk of vaping leading to nicotine dependence or even transitioning to traditional cigarettes?
All right. Let me break it down. All right. Let's put it into people who are just starting to smoke and
Hmm.
people who are trying to quit. All right.
Okay.
So these are two different aspects that we need to consider. So take it into adolescent population and adult population. Adolescents are someone who is quite new to the smoking, this habit, and adults who are already used to smoking and who are trying to quit. These are two different aspects.
And
So see, where does vaping stand? A lot of people see if let's step up at the positive aspect first. Regarding the adults who are already used to smoking, this thing will serve as better than nicotine replacement therapy. There's something called as nicotine replacement therapy, where we give patches, we give lozenges, we give gums to make to deliver nicotine in a very safer way, so that they'll slowly quit smoking, and then slowly we can taper down the dose too, and then completely they can quit smoking. This is what we do in a hospital and a smoking cessation clinic. This is what we do. But coming to vaping, you know, this thing even it delivers nicotine. All right. So, but you can actually kind of titrate the dosage. You can kind of nullify the effects of all the toxic, harmful things that are present in the cigarette. So this is where it stands. It is definitely better than the nicotine replacement therapy and study. But coming to adolescents, the the taking up of e-cigarettes or the vaping in adolescents has come down as compared to the previous year. That is, this data is from 2024, I suppose, and it has come down from the year 2023. But mind you, this all this data that we have is from the Western data. We don't have good studies that have been done in India. I mean, the thing that is very difficult that people don't come forward to accepting that they okay, I do vape or I do smoke. That is the main problem
Yeah,
that
it's
we
still a
face in India.
stigma, yeah, to
Yeah,
accept it.
exactly. So we do not have any proper studies, out there done on Indian population.
Mm.
All right. So, but the two take home points over here is yes, nicotine, these vaping will definitely help you. Better nicotine replacement therapy, the patches and all these things in adults who are trying to quit smoking. But
Mm.
this is definitely not something that is, should be advocated to the adolescents who are starting to smoke. Because since it contains nicotine, at the end of the day, you're still going to get dependent on vaping. And if you're dependent on vaping, there's high chances that you will completely transition into conventional smoking. So yeah,
Definitely.
yeah, take it
Yeah.
as a double-edged sword. You can actually kind of
Mm.
kill what you're trying to kill, and in this process, you might actually kind of stab yourself.
That's really important, especially when you highlight the vulnerability of the younger usage also. So it's really important.
Yeah.
So now, doctor, are there any particular gaps in research that you believe needs to be addressed so we can better understand the full health impact of vaping?
Yeah, as I've mentioned in the previous question,
Yes,
there's a
yes.
very big gap. See, all these studies that we have been talking about, or we will talk about further in the next coming year, on the Western population. We need
Hmm.
more studies on the Indian population.
Correct.
All right, that is this first aspect, and that too, we need specific studies on population, on diversities in adolescents, in adults, in people who are trying to quit, and we are not taking up on people who are already having comorbidities. Mind you, like imagine the person having a cardiovascular disease. Did we do the study in them? No. And there are lot of patients who are actually kind of smoking or vaping when they're pregnant. So do we have studies when they're pregnant? No, we do not have. So we need lots of studies regarding that, and we need long-term studies. It's not just a study done for weeks or months together where you do not see the result. We need long-term effects. For example, you know these e-cigarettes, they contain heavy metals, right? So
Mhm.
these heavy metals, how do they affect our body? That, okay, theoretically, that these heavy metals will cause toxicity to your body, but how will they affect your body in the long term when you're taking through the vaping? We do not know. So all these things need to be addressed in a particular way, and I hope a lot of people come forward to do research on vaping, and a lot of people kind of accept that we need to provide to the research regarding vaping so that it will be better for the future.
Yeah,
So
even
yeah.
I feel the gap is, I think a bigger gap, and I think the point that you mentioned about long-term outcome is also key. That needs to be addressed also.
Yes.
So now, doctor, how should healthcare professionals approach patient counseling when it comes to vaping, especially in two sensitive groups like teenagers experimenting with vaping and smokers, as you also distinguished the two classes earlier.
Yes. 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 So all right, let's put it this way. First things first. Let's not, you know, how do you put it? Don't treat it as a social stigma. Oh,
Hmm.
you smoke. There are two different things,
Yeah.
man. Because depending on the population, some people feel that smoking is cool. Where if you don't smoke, you're unfit to be in their the part of the group.
You cannot fit, yes.
Yeah, and there's one more part of the group where they don't even get you closer if you're smoking. So we need to bring that thing down. We need to have more awareness. All
Hmm.
right. See, platforms like these, MedSynapse, and we need more multiple platforms where we need a lot of awareness in people. All right. How what we just see these ads before any movie. No, in a theater. That's the only thing that we get to see regularly. But we need more awareness campaigns. All right. So that is one thing. And coming to your question in specific, for adults, yes, definitely this will work. And it is quite. easy for us to engage in counseling with them and tell them that, see, sir, this is what it is, this is what has happened. Get a good medical test done and show them the proof that your health is deteriorating because of this, and this is how we can benefit from, well, replacing conventional cigarettes with e-cigarettes, or maybe slowly quitting it down. But with adolescents, the risk is very high, man. See, as I've mentioned before, they're either just starting. So if we
Mm-hmm.
ask them, okay, rather than having a conventional cigarette, take an e-cigarette. You can kind of make them dependent on e-cigarettes, and them with those, you know, quite difficult, what do you call the behavior. It is not easy for us to kind of counsel them that, please, this is not safer for you. This is not what you need to do. No, it is not. They like, see, the e-cigarettes. They have flavors, the candy flavors, and all these
Mm-hmm.
things. They find it cool to be using the
Correct.
e-cigarettes. So, right. So, adolescents, it is best thing to advise them not to smoke at all. Let it be
Mm-hmm.
conventional, let it be vaping. It's better for them, for us to put them completely apart, no, completely away from that. And coming to
Definitely.
adults, it's better for us to tone it down. It is easier. So
Mm.
these are the two aspects. So counseling, adolescents, don't smoke at all. Completely try to quit it down. But adults, yeah, we can taper it down. That is the best approach. Yeah.
Yeah, yeah. I think that's like a balanced approach also that you mentioned, not alarmist, but also, not even much so dismissive as well. So I really
True.
like
True.
that, Doctor. So now,
True.
Doctor,
True. Yeah.
finally, where do you see the future of vaping regulation and clinical research heading in the next 5 to 10 years there?
See, this all depends. See, clinical. I'll come to the clinical research aspect first. Clinical research, yes, the studies are, they're improving. A lot of people are coming forward, but we need much more studies, better studies. That as I mentioned before, a lot of them are
Definitely.
being done in the western part of the world, not in this particular segment of the world. And mainly in India, that too, we need a lot of good studies. That is the
Mhm.
clinical research aspect, and we need studies, long-term studies regarding the harmful effects of vaping and all. And coming to the first part, the regulations part, it all boils down to how we are going to treat the conventional cigarette. If you've known, a lot of governments across the world, I'm not talking about India, across the world, they're completely banning cigarettes. They are not giving it to people. No, they're basing on their they take it a Aadhaar card or any date
Yeah,
of
yeah.
birth. Basing on the date of birth, they're actually imposing bans that, okay, if you're born after this particular year, you will not be getting any cigarette. All right. These regulations should be, very strict in India. See,
Correct.
the problem is how strict or how particular can we be? It's very difficult because antibiotics without prescription, they should not be given in the medical shops. But trust me, you go ahead to any medical shop, say that you are feeling sick and that someone has prescribed this antibiotic, name an antibiotic, they'll definitely give it to you. These are some
Yes.
restrictions and rules that needs to be very strict regarding the regulations, and we need regulations regarding even disposing the, cigarettes and all, because cigarettes, they contain heavy metals and all. We need regulations regarding the amount of nicotine that is present in the e-cigarettes, because we can't randomly put whatever the amount of nicotine present in the, because they give you a higher hit according to the
Yeah.
yeah, people. No, already, if I'm not wrong, the European Union has already imposed a regulation that is around 20 milligrams, if I'm not wrong, per ml, and these are the same restrictions that we need to impose in our country too. All right.
Definitely.
So restrictions regarding disposal of the e-cigarette. No, let's put it as, let's make it simple. Restrictions right from buying.
Hmm.
It should be difficult for people to buy cigarettes, not just
Yeah.
vaping, not just e-cigarettes. It could be, even the conventional cigarettes. It's
Correct.
let's make it difficult. Don't look it as a source of revenue for the country. Rather than that, let's try to cut it down on the first part itself.
True.
Okay, you bought it. Have a regulation regarding the nicotine amount of nicotine in the cigarette. That is while smoking, and the disposal part. Have regulations regarding the disposal of the nicotine caps, nicotine, the complete container. All this we need to have much more regulations. And yes, the second part of it we'll discuss again one more time. I just want to reinstate. We need more research. We definitely need more research regarding that. We need, in India, I'm actually kind of starting a research study regarding e-cigarettes. So I need
Oh,
more people to give in forward their opinions and their information regarding the
true, true.
e-cigarette usage.
I think that's really necessary, especially in India, as you also mentioned. And I think stronger regulations should be implicated because recently
Yes,
also I read somewhere or I was having a conversation with somebody saying that cigarettes at least come with a warning sign, but
yes.
e-cigarettes do not come with that, with
No, no,
even
no,
with
no.
a warning sign, which
Yes, yes, yes.
actually is very attractive for younger teenagers, I would say, younger generation. So that there's no warning sign as such for e-cigarettes also.
Yes, I would love to add one point if it's okay.
Yeah, yeah.
So the e-cigarettes, a lot of people think it is safer. This point we did not discuss in
Yes.
the in any of the questions.
Yes.
Yeah, a lot of people think that e-cigarettes are safer than the conventional cigarettes. I'll tell you, conventional cigarettes will slowly kill you. All right, it'll definitely have. The problem is a lot of people think, okay, I have no issues using conventional cigarettes,
Mm,
but mind you, these people either live long enough to have lung cancer or die
yeah.
younger with cardiovascular disease.
Correct.
All right, that is the first thing.
Mm,
And coming to e-cigarettes, people think it's safer, but it is not. There's something called as EVALI. I want people to check it out. EVALI is EVALI,
mm,
e-cigarette, electronic vaping associated lung injury. So
mm,
there's an entity EVALI where the lung, we've seen COVID, right?
mhm.
So the lung kind of gets into a situation where you hit with a very severe kind of COVID, where you need to put the patient in the ICU and where you need to put a lot of medication like steroids and everything to bring that thing down. It is a very dreadful situation where it's 50-50 kind of situation for the patient. And I've had a case recently who's a known friend of mine who's been vaping. I've asked him to quit it for a long time, but he did not. And unfortunately, they have landed up in the
Oh,
ICU. But yeah, we're very fortunate that they've come out of it. But yes, these are the things that
it
we need
just hit
to
you.
keep it in your mind. So yeah,
Correct, correct. I think awareness is really important because I've been in this industry from quite a long time and I was not aware about it. So it's really
yeah,
important for
yeah,
everybody to know about this also.
yeah.
So that's a very good point that you've mentioned, Doctor. Uh, so,
Thank you.
Doctor, thank you so much for walking us through the both science and actually the clinical nuances of vaping and e-cigarettes. So, thank you so much for sharing your insights on this
Thank you.
topic today.
Thank you, Misha. Thank you so much.
Thank you. And to our listeners, this is clearly an area where myths, evidence, and patient counseling overlap in every real way. So stay tuned for more such episodes. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay curious, stay informed, and keep leading conversations that matter.